female pelvis plays a vital role in pregnancy, labor, and childbirth. It supports the pelvic organs, carries the growing fetus, and forms the passageway through which the baby is delivered. For nurses and midwives, understanding the anatomy of the female pelvis is essential for safe maternal and newborn care. The pelvis is a strong bony ring located at the base of the spine. It connects the trunk of the body to the lower limbs and provides stability during standing, walking, and childbirth. In females, the pelvis is wider and more flexible to allow for pregnancy and delivery. The female pelvis is made up of 4 main bones. These include 2 hip bones, the sacrum, and the coccyx. Each hip bone is formed by the fusion of 3 parts: the ilium, the ischium, and the pubis. The ilium forms the broad upper part, the ischium supports body weight when sitting, and the pubis forms the front of the pelvis. Together, these bones create a strong but supportive framework for childbirth. There are 4 basic types of female pelvis. These are the gynecoid, android, anthropoid, and platypeloid pelvis. The gynecoid pelvis is the most common and the most favorable for vaginal delivery. It has a rounded pelvic inlet and provides adequate space for the baby to pass through during labor. The pelvis is divided into 3 important regions that form the birth canal. The pelvic inlet is the upper opening of the pelvis and marks the entrance into the true pelvis. The pelvic cavity is the curved, hollow space through which the baby descends during labor. The pelvic outlet is the lower opening, through which the baby is finally delivered. For a safe vaginal birth, the inlet, cavity, and outlet must all be adequate. The female pelvis differs significantly from the male pelvis. It is wider, shallower, and lighter. The pelvic outlet is larger, and the subpubic angle is wider in females. These differences allow the female pelvis to support pregnancy and childbirth. In clinical practice, pelvic anatomy directly affects labor and delivery. The gynecoid pelvis is the most suitable for vaginal childbirth. Abnormal pelvic shapes may contribute to difficult or prolonged labor. This is an important concept for nursing and midwifery examinations. A clear understanding of the female pelvis helps protect both mother and baby. Subscribe for more simplified nursing and maternal health animations.